At 9 o'clock, despite that watch on the wall there. Welcome to the Senate Education Committee. We'll be discussing SB 343. But before we do that, will you please rise and Senator Lang will say the allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Where do we have Senator Innes? He's coming. So Senate Bill 343, the sponsor of the bill is Senator Innes, and he is right here.
I see, Madam Chair, he's following the rules and make sure he signs in before he speaks to.
Good morning, Senators, Committee Chair. It's a pleasure to be here on this beautiful snowy day. And I am Senator Dan Innes from Bradford, New Hampshire, representing District 7. And I'm here this morning to introduce to you Senate Bill 343, which has received a fair amount of attention over the last couple of weeks, particularly on the internet. And I think this is a real solid little bill. It has to do with school-based health services, and that might be something relatively new to folks. But the federal government is now offering funding to public schools to essentially start a small doctor's office within the school. And there are 2,700 of these now across the country. There are four schools in New Hampshire that either have them or are seeking to establish them with federal support. This bill sort of puts some guardrails around it and brings parents into the process of children being treated in schools. And there are a couple ways to look at this. One is to say, well, the schools shouldn't be in this business. Maybe, maybe not. But the fact is, the federal government is funding it, and schools want to take these funds. I can also see the point that there are a lot of disadvantaged kids, particularly in some of our cities and rural areas where it can be difficult to get a general practitioner, or maybe the parents don't. So this is an opportunity for children to get the health care that they might need. At the same time, we don't want it to go too far, and it's important that parents be involved in the healthcare decisions of their children. So what this bill does is sort of define what these centers can look like in our state. It specifies that school nurses can't be fired just because you put one of these in place. And it has a consent piece to it that requires that parents essentially opt in to the program. And must give that consent. It further states that parents need to be there when a child is seen by a school physician. So I think this does a lot of good things. It recognizes that these are coming. There are already thousands of them around the country. And if they're going to come here, and they already are, then let's make sure we do it right and that parents are engaged and involved in the healthcare decisions involving their children. I'm happy to take any questions if you have them, and there may be some folks yet to testify.
Senator Prentice?
Great, thanks. Good morning, Senator Ennis.
Good morning.
Good to see you here. So tell me about, so there's 4 sites already in New Hampshire. I don't need to know where they are as much as what do the configurations of staffing look like? Like how do they deliver their care?
I can't answer that. This was just a discussion with Commissioner Edelblut, and I asked how many were in the state, and he said there are 4 that are either established or in process, and that was pretty much all he had at this point.
Okay, good. May I follow up? Yeah, so we're keeping the school nursing system intact.
Yes.
Okay, and with the school nursing system, all of those consents are with that.
Yes.
And transfer over to this.
Yes.
Okay, it is, I see it as a way to bring, basically to improve access to healthcare in some of our more rural and underserved areas. I just wanted to know if, and I can, if Commissioner Edelblut, if you're listening, or I can ask the question, PAs, physicians, nurse
Yes.
practitioners, like what does this look like? And would the records from there be made available? I know, so they wouldn't be billing for these services. But
Correct.
they're going to use the standards of HIPAA
Yes.
to protect the privacy of the the medical care that takes place.
That's
but
correct.
There would probably need to be some type of interface where if you were seen at these clinics and then referred to your primary care or a specialist, a way to make
Move
that
those
paperwork-
records with it.
make that paperwork
Yeah.
move, which might just be a release. I might be getting into the weeds here, but I think that that's the only, it's not a concern. I just want to make sure that those kinds of things happen.
Yeah,
Okay.
I think you're right, and they would need to happen. I don't know why they wouldn't. But then again,
You know, just want to make sure that these pathways are smooth
Yeah.
out.
I mean, maybe there's an amendment or adjustment we could make in
And
that
we might
regard.
not even need it, but
Yeah.
I'm going to follow up just to find out how they're staffed. But
Okay,
Thank you for bringing this bill forward.
thank you.
Okay.
Senator Lang.
Thank you, and thank you for taking my question.
Mm.
So my question is around consent.
Mhm.
And is it your intention in the bill that for each unique service provided, there has to be consent? Or my concern is that there might be a blanket consent waiver given in the beginning, and then the parent still has no idea of what services are being offered.
Well, the intent is that consent is given, it could, in a blanket sense, right? But the bill also wants the parents there when these things take place. And I think that's an important distinction. So parents are engaged and know what's happening, right? They're not signing a blanket consent and they're passing out, drugs like candy to your child without your knowledge, right? That should not happen the way this bill is written. Okay.
Follow up?
So again, I know with like in nursing services now, when my kid, I got 4 kids, when they brought their consent form came in from the nurse, they literally had a checkbox. Can I give your kid aspirin? Can I give your
Yeah.
kid a cough syrup? Can I give your kid,
Right.
and you can check yes or no on each one as to what they're allowed to give without parental consent, without calling the parent.
Right.
Is your intention again here to make sure that with each unique service, a parent knows 100%
I
of what's
get-
going on?
I understand now your question. Yes, that is the intent.
Thank you.
Yes.
Right
Okay.
down to my-
Any other questions? I guess that's not, you're all set. Thank you very
Okay.
much.
Thank you. Appreciate it.
Okay, I will call the first person here is Emery Banfield. And if you can limit your testimony to 3 minutes, we would appreciate it.
Anne Marie Banfield, and I'm opposed to this. I'm a parental rights advocate in New Hampshire focused on education. I'm going to cut to some of this. I do like obviously the parental rights aspect of it, but this bill, in my opinion, if you read it, goes further. It gives legislative approval to school-based health clinics. If they're doing that on their own. I think if you're going to pass a bill for school-based health clinics, it needs to be far more in-depth. You need to have rules, regulations. This is Massachusetts. This is their law on school-based health clinics. It's 7 pages long. For instance, if you're going to open a school-based health clinic, do you know that hospitals have to have an interpreter there for their patients within 30 minutes? And if they don't have an interpreter there, they can be sued, and they have been sued after 30 minutes. There's a lot of regulations on hospitals. Who gets sued in that situation? Medical staff are mandatory reporters. They can report a parent not showing up for an appointment. How will that be handled? Who would be responsible for malpractice? Unsuspecting parents sign general waivers at the beginning of the school year and may not realize that they have inadvertently given school permission to refer their son or daughter for counseling, prescriptions, psychopathic drugs, birth control, or even an abortion. Last year, 2 children in New Hampshire were vaccinated against their parents' wishes, and this was with parental consent. The parents sent a consent form saying, "Do not vaccinate my child." They didn't read them. And they gathered up all the kids whose parents had sent a consent form in. In Maine, a father objected when his daughter came home with a small bag of Zoloft. This is an antidepressant medication, and said he never consented to the treatment or medication. He wasn't sure if he had signed a blanket statement at the beginning of the year. Zoloft can cause suicidal thoughts in the patient. When the father called the principal at Lawrence High School to complain about the undisclosed drug treatments the school clinic gave his daughter, the principal insisted that the school-based health clinic was a separate entity from the school and not under his control. So who takes responsibility for these things? Representatives from the Bulldog Health Center, which is operated by the Waterville-based health research community, told him that they were legally allowed to give his daughter prescription drugs without informing him. So after withdrawing his child from the school, he was visited by Child Protective Services, who later said that there were no warranted issues against him. So somebody sought retaliation against this father. What about sharing medical information? We know that right now schools are sharing mental health, personally identifiable information with outside resources.
30
Keene
seconds
State,
left.
Keene State BHII. That this goes against their code of ethics, the school counselor's code of ethics. There's nothing in here about data privacy. There's nothing in here that says how this data will be shared. In East Stroudsburg, Pennsylvania, years ago, 6th grade girls were forced to undergo a genital exam, and their parents were not informed, and they did not consent. This was done at school. This is how far this can go. Parental consent, I support that, but President Biden just said that he wants no parental consent on Medicaid billing from schools right now. He is working to remove parental consent from Medicaid billing. So this is my concern about this. And this bill is one page. If you're going to do something like this, if you're going to give legislative approval, I want to know exactly your question. Couldn't even be answered by the sponsor. I have the same question. This is primary care in a school setting. What about the primary care doctor? How are they brought into this? What about kids with asthma who have to see a pulmonologist? There are so many questions that this bill does not answer, and we're already starting it. That's a problem. So if you're going to do this, it's got to be far more detailed. This is nowhere near ready for prime time. Oh,
Senator
by the way,
Prentice.
Senator Ward, I support your bill for parental consent,
Okay.
SB 573. And I've got-
Senator Prentice.
Thank you, Senator Ward. Good morning. Mrs. Banfield or Ms.? I know Anne Marie, but, okay.
However,
I feel like over the years, we start to get to
Sure.
know folks that come in and see us regularly. So part of what I hear you saying is, part of what I hear you saying is that this is a basic, like, say, frame for a house, but without all of the details for the inside. And if we were to add a rulemaking provision on exactly what needed to be outlined in administrative rule for schools that wanted to do this, that were underserved or more rural areas to have these school clinics, that would be something you would be looking for. I can't say that you'd support that at this point, but you're bringing forward the fact that there's no, like, say, rulemaking that's included in here at this point.
thank you for asking for clarification because I don't want to mislead you on any of this. I oppose this bill. I oppose this idea, and I'll tell you why. Some of what you brought up, but at the same time, if you've been to the hospital, and I asked people working in the hospitals at CMC and Elliott recently, are you understaffed? The answer is yes. If we open up school-based health clinics, they're going to be pulling from the same labor pool as our hospitals. They're already short-staffed. The purpose of that Medicaid expansion, I thought, was to provide everybody with care if they needed it. So now we're going to open up these clinics throughout the state. Where are these people coming from? I just saw an ad for Elliott Hospital on Facebook. They are hiring for every position at Elliott Hospital. This ad's been running on Facebook the last couple of weeks. So I think it's actually irresponsible to pass a bill like this providing these services when you have that lack of staff in our hospitals. Doctors are looking for people to work in their offices. Where do you draw these people from? You're going to pull from that labor pool.
May I
Senator
think?
Prentice, follow
So
up.
thank you for your comment. So what you're saying is, even with rulemaking, to clarify, you would not be in support of this?
No, I wouldn't.
Okay. And
But
then-
I think if you're going to pass this, that's where you need to go.
Okay. And, to your comments about the competition in the workforce, the healthcare workforce, I am well aware of those because that's where I spend most of my time, is in the healthcare arena. But I don't think it's a reason not to consider. One of the things that concerns me the most is the lack of access to, family-based care services in some of our more underserved areas. And, not everybody has a Clear Choice MD or, an urgent care. And if the schools, which become the most common hubs for activities are able to do something like this with the proper guardrails put in place. You know, I think there's work to be done, but the concept itself, you know, I'm not necessarily opposed to. Can I ask, Senator Ward, just a couple more things? Did you, Bulldog Health Center?
Yeah.
Where's that?
In Maine.
So no comments on any of these that are currently running, or we've heard that there are 4 of these in New Hampshire.
Yeah.
You have no examples of any problems at the 4 of these in New Hampshire. These are stories, Strasburg, Pennsylvania, Maine, nothing.
Except the 2 kids that were vaccinated
The
this
two-
year. Yes. yeah.
Understood. And
Yeah.
I think that Senator Lang and I'm not going to speak for Senator Lang, both are interested in making sure that it's not like my daughter Phoebe, every year when she started school, I got a piece of paper that asked me to sign the consent for the school nurse. But something like this has a higher level of consent that's applied to it because it's not the school nurse. It is actually a health clinic. And then did you state that there were surgical procedures being done at these? You said abortion. Is that?
In mass, yeah, there's all kinds of care. They could recommend out. They could
So they're not being done there.
no,
But-
not that no. So
Okay,
thank you
so-
for asking for clarification. No,
Right.
that these are the procedures that could be recommended out. And so while you would want to pair, if my daughter went into a health clinic, I have a blood disorder that's very thick, and it thickens my blood. Sorry, I'm not permitted to go on birth control, I would want that school-based health clinic person to know that if they're treating my daughter, that this is a genetic disorder and that she could have a stroke and die if they put her on something. So if I'm in the room, yes, I can share that. If I'm not in the room, if they start doing this without parents there, I may not think to tell her something like that. I did, obviously. But what I'm saying is a parent may not know that, and they may, well, in Massachusetts, they stuck one of those implants in a 16-year-old's arm, and the parents were not aware of it. So that kind of frightens me because that's a ticket to a stroke or death in my family.
And Senator Ward, I'll end at this. I believe, if I'm reading this correctly, and I'm going to have to go back, is that they could not get these services unless a parent was part of it.
Yes,
So that is
yes.
not even an issue here. They have to have the parent, the very framework. And again, I
Yes.
think there needs to be meat on the bones.
Yep.
But the
Yep.
very framework requires parents
Right,
in the room.
right.
All right.
Yeah.
Thank you for taking my questions.
Thank you for making it a little more in depth. I appreciate that.
Not a problem.
No more questions. Thank you very much.
Okay.
Look at this snow.
I will send you this electronically so you have the links because I have some links in here. And then
the
I
next one
do
we have Melissa Bisick.
Hi, I'm Melissa Blasek. I am here representing Rebuild NH. I'm the executive director and from Merrimack, New Hampshire. Thank you, members of the committee. I'm here today to oppose SB 343. I believe that the intentions behind this bill are to add guardrails to these school-based health clinics that we are currently seeing in public schools across the state. Currently, these clinics are being funded by federal grants, but it's not a matter of if, but when these grants run out, leaving the taxpayers on the hook. I'm struggling to see how this bill, as written, adds any guardrails to the system that is currently existing. If we truly want more transparency and accountability, this bill should require that the clinics be funded through warrant articles. Section 2F is the only part of the bill that I feel is above and beyond the current law, as it requires the parent to be present for medical treatment. We already have parental consent laws for any type of healthcare services in schools. I do support this addition to the parental consent law. However, I don't think the rest of the bill is particularly helpful. SB 573 deals with parental consent, and while I have a couple of issues with it, I think that if we're attempting to strengthen parental consent laws, SB 573 is a better vehicle than SB 343. Unfortunately, too many schools in New Hampshire are currently failing. When we expand the mission of schools past their primary obligations of teaching reading, writing, and arithmetic, we are not focusing adequate time, energy, or resources on the fundamental mission. Schools are for educating, not for healthcare. I urge the committee to oppose SB 343 and work to strengthen parental consent through other means. I just want to add one other thing that, as far as healthcare access, I do believe this is why we have Medicaid. No, so I don't quite understand that argument, but I will take any questions.
Thank you.
Senator Ward, thank you, and thank you, Ms. Blazik, for joining us this morning. So just in terms of your last statement about access, yes, we have Medicaid and we have Medicaid expansion that can support access, but this is about sites and locations. Not everybody has a car to get to a hospital. Not everybody has a car to get to a medical clinic, but they may have a bus to get to school, and their parents who are tied up working could then come and meet them there. You know, I'm not a sponsor of this, but I do think about systems of care. So in terms of access, this is yet another point of access where I live in Lebanon. There's a Clear Choice MD. There are 2 hospitals. It's not true throughout the state. So that's the way I try to approach these. So Medicaid is there to support in terms of expansion, care in those settings. But this isn't even a billable service. But I just
Is there a question?
No, I'm providing a clarification and getting it on the record. Thank you. Thank you.
All set? You have a question? Thank you very much. Next one, we have Lucianne Chester.
Thank you, committee chair. Thank you, committee members. I was going to originally start by talking about my personal experience as a parent to a stepchild who ended up being in this kind of exact kind of a situation. But I want to start by saying one of the school systems is Manchester, New Hampshire, okay, that is doing this right now. It has had little to no cooperation from the constituents, but the school board is very much on board with it. And you heard Anne Marie mention that Elliott Hospital is one of the hardest to find people. 90% of the people are going to, 90% of that group that were working at Elliott are all flocking to this. They have nights, weekends off, and summers off. So this is part of the problem, okay? With regards to Medicare and Medicaid, if you are on Medicare and or Medicaid, you can get free transportation for any service you need, anywhere you need to go. So rural areas are not an issue. Now, I just want to talk to a little bit about the sponsor of this bill. Basically, this is being brought forward because the federal government is offering funding. And we know in the last 3 to 4 years, every time the federal government is offering us money, it comes with strings attached. And bottom line, that was our money first. So now I'm going to tell you a little bit about my story. I had a 12-year-old stepdaughter, who was abused sexually, physically, and emotionally abused by her mother and stepfather, starting that I know of at age 3. That's what she remembers.
You have 1 minute left.
Chances are it was a lot longer than that. During the 5th grade curriculum, I got the letter saying that they wanted her to participate in sex education. I spoke with her about it. She said, I want to do it. I don't want to be singled out. I allowed her to go through it. I saw changes in her. I kept going to the school counselor, begging. I said, something is going on with my child. Please help me. Now, I didn't tell the school that my daughter was a sexually abused child. It wasn't their business. I had her in counseling. I had her on meds. This school system, and this was a long time ago, this counselor and this school system not only reported me and my husband for sexually abusing her, but did a gynecological exam and provided her with birth control pills, and she attempted suicide 3 times before I found out. So you can't sit here and tell me that if you do something like this, it's not going to cause a problem, because it has, and it will. And the bottom line is that we have been right so many times in the last 2 years. What if we're right this time? Do you want to take that chance? The Bible's very clear. Thank you.
Thank you. And, wait a minute, any
Oh.
questions? Okay, thank you very much. Audrey Friedman.
Madam Chair, committee members, Aubrey Friedman, live in Bridgewater, private citizen. I speak in opposition to this bill. Schools, they should be schools, and I think we should have a separation, and we're getting way into this area where schools are becoming like hospitals, and schools, frankly, are not doing a great job as it is. There should be focused on academics, and this is a further distraction. The bill says that these centers, they're actually going to be in the school or near them. And there's enough going on. There's so much the extracurricular stuff, the social, emotional, everything. Academics is a very small part of schools. And frankly, I think you've heard me speak about the proficiency results, and I've attached one or two of the NAEP reports I'll provide it as backup. But clearly, they're doing a poor job on educating. The academic stuff, the reading, the math and science scores in the 30s and 40s. So this is a further distraction. I think it will make things worse. And I also think there's not really a cost mentioned here, but it seems to me school personnel are going to have to be doing some more admin work here. So will be a further cost. They already have a lot of stuff satisfying state requirements and federal requirements. So I think there will be extra admin costs here. Supposedly the billing for services will go to the federal government. I know in our own school district, we have a Medicaid, our own separate number already. So it is there. I say this is moving it in the wrong direction. Let's get back to basics, keep schools as schools, not as hospitals. And that's it. Thank you. Are there any questions?
Questions? Thank you.
Okay, thank you.
Al Brian Hannah.
Thank you, Senator.
Go ahead.
Thank you. Nice to see you again, Senator. My name is Al Brandano. I'm from Kensington, New Hampshire, and I'm opposed to this bill. For me, on the way over here and last night, trying to read into this, I always kind of go to the Constitution, this little green book that we get in New Hampshire, and I couldn't find your authority under this Constitution to do something other than educate. I don't find the authority in here. And I think one of the challenges for all of us is we all want to do good. We all want to expand our power and do things, but is it repugnant to the Constitution? You swear an oath to the Constitution. This is where it comes from. So I think we need to really always kind of go back to it before we take the next step. The second part of this for me is the cost basis of analysis. Has anyone done a cost basis of what happens when the money runs out or when the program stops? Right now, it's a pilot program, my understanding, and there's no measurements in this pilot program. It's federal, it's not state. We don't have any oversight. The state has no oversight over it. So we don't know what the cost basis is. I can tell you just in SAU 16 in my district, we have a $69 million budget. There's roughly 2,000 students, a little over 2,000 students. That's 30,000 that the citizen is educating right now, paying to educate a student in SAU 16. What will the cost be with this when it comes off the federal programs and comes back to us? I have no idea what that's going to be. But right now, we have citizens that can't pay their tax bills. This is, rearranging the deck chairs on the Titanic for a lot of people financially. So we need to take a look at the cost basis. And my next question, can a regular citizen go to the school and get health care? I don't know that answer. If we're paying for it, could a citizen just show up and say, hey, I'm demanding health care? I don't know. I don't know the boundaries of it. I don't know what's allowed or what isn't. I couldn't find that. And once again, most importantly for me is it's really no vote of the legislature that allowed this to happen. This is a pilot program only. We don't have to accept this. And our citizens are not aware of it. And there was no vote of the legislature to even debate it. So I'm opposed to this bill. And if you have a question, I'd be happy to answer it.
Questions from the committee members?
Thank you.
Seeing none, thank you very much. We have Nancy Rovinen.
Thank you, Senator. Hi,
Welcome.
Hi, Nancy Biederman. I'm a parent of 2 chronically ill children and a resident of a rural area. I will have to say that when we first moved there was a medical doctor's office in the area. It closed down over 10 years ago. It could not be sustained because there wasn't enough need, or they just couldn't make it financially. It was also an Elliott-based medical center. So again, they just couldn't keep it staffed. I am, first of all, against this bill. I'm against school-based healthcare totally. As a parent of kids that have had 504 plans, I've had to fight for my children to have accommodations in the school, and have had to fight school nurses because they would not follow what the specialists had recommended for my children. I've even had to go so far as to call in the chief of the fire department to allow my child to be in a safe environment so that she did not have a reaction to this wonderful weather that we have and go into anaphylaxis because the school and the school nurse did not realize how dangerous this was. I think that's pretty extreme that a parent has to do that. So if you bring in a school-based health care system, are other parents going to be fighting this also with other people and doctors and other medical people not listening to outside medical personnel that are trained and have more knowledge on specialized care? I've read the contracts to some of these school-based healthcare. Their main push that they want is vaccinations, because, oh no, most parents haven't been vaccinating in the last few years because of the pandemic and haven't been going to the doctor because of the pandemic. Pushing vaccines on parents, not part of the school's job.
1 minute.
And then the other part is pushing mental health. Again, you're going to sit there and have a stranger assess a child for 5 minutes and decide whether they need mental health services and then push it on them. And I mean, you all are saying, yes, the parent has to be in there. But I'm telling you right now, I testified multiple times last year on bills that they wanted to make the age of consent at 13 in New Hampshire. And that needs to stop. The age of consent is 18, and that is when a person is an adult. So yes, you're saying, oh, the parent has to be there. But then the doctor's like, well, the child told me something in confident. It's patient confident and parent, confidentiality, and we're not going to tell the parent everything. That's not going to solve this situation, especially when you have a stranger. So again, against this financially, this is not a sound situation. And again, why is the federal government trying to do something when us rural parents, believe it or not, we get our kids to the doctor when we need to? It's not that big of a deal. We all figure it out. Thank you.
Thank you very much. Questions from the committee members? Thank you.
Yep.
That's all I have for people who like to speak or have signed up. Is there anybody in the audience?
Can I ask Anne Marie to come back up so I can ask her a question?
Sure.
Anne Marie, would you mind coming up?
Let's see.
I noticed you had left the room.
Yeah, sorry, I had to
That's
run out
okay.
and introduce another bill in another committee.
Oh, okay.
So I had a question I'm trying to understand what we might do. So currently, as I understand it in testimony of this bill, is that we have 4 centers running basically with no regulations at all. Parental consent is questionable whether or not it's needed. So I guess I'm trying to struggle with the idea of I'm a little nervous about outright banning. Because I had 4 kids and the school would run a school physical day and we could take the kids in and get our school physical in a given day. Parents would bring the kid in and get that taken care of without having to worry about trying to get a primary care doctor visit, which could take you 6 months. And the school would host that. So an outright ban might ban, so to speak, those kind of activities, which I'm in favor of. It makes it convenient for parents and the parents are there because they're bringing their children. So I guess where I'm trying to get to is I'm concerned absent this, the ones that are running under no regulation whatsoever, no parental consent guidelines whatsoever. And secondarily, if we outright ban them, then we run into problems, like I said, with the school physical, sports physical clinics that they would hold, where they bring a primary care doctor in and have 6 hours. You just bring your kid in, have the physical, and go home. No appointment necessary, kind of thing. So, how do we manage that? How do we deal with that? What's your recommendation for?
Right. I see Senator Prentice's point about making sure that this is available to parents. And while you were out of the room, I brought up one of the situations that really concerns me is the lack of staff, the lack of staffing in our hospitals currently. Elliott just ran an ad saying that they're hiring for every position. I know people who work at Elliott. I know people who work at CMC. I checked, but with both of them, cardiac unit, you can't even go in for cardiac care because they can't staff. Well, you can go in for cardiac. Let me be clear about this, but they do have a shortage of staffing in their cardiac unit. So some of the beds are not being utilized. My concern is this draws from that pool. So that's something that I think is very important. I would suggest that you read what Nancy had brought up, what the DHHS is requiring of these school-based health clinics. I would suggest going through that. That would probably answer some of your questions. I mean, it may answer some of yours, because there are some regulations that in order to get the money, but those regulations didn't come from you, and that's why I added my the form from Massachusetts, their law is 7 pages. But I think, and the gentleman behind me brought up a good point about school-based health clinics. The more that we are shifting the focus of public education away from public education, it's not helping our students. It's not helping the schools. We can make a case for we need a law that requires a doctor to go to everybody's home who needs it. I mean, where do we say, okay, this is going too far? I think this does go too far. However, you're right, there's some guardrails that probably need to be included. So I would double check that parental consent. I think in that, well, we have a law. We have 200, RSA 200 something that requires school nurses. It talks about school nurses and it talks about parental consent. I do like the idea of parents being there. I think that one provision in this bill is a good provision. Parents should be there. But as I mentioned to Senator Prentice too, we have President Biden right now seeking to remove parental consent on Medicaid payments that are paid out from schools because he wants to streamline it. Well, parents are the overseers. They're the ones catching the fraud. Do you know that there's been fraud committed by these schools in the past? So removing parents might streamline it, but at the same time, there's been fraudulent cases. So if you're looking for my answer, I just don't think that this is a good idea overall. But if you're going to go forward with it, if somebody's going to go forward with it, this bill does nowhere near what I would expect to see. I brought up that interpreters need to be to their patients in the hospital within 30 minutes, and they've been sued if an interpreter is not there within 30 minutes. How do you handle that in a school-based clinic? Maybe the child speaks English, maybe, the parents don't, maybe the child could interpret it. They have iPads now that help, but there are a lot of regulations on medical facilities. I think if you're going to do this, you need to know what is required of these school-based health. Do you have to have an interpreter there? And I mentioned also that medical people are mandatory reporters, and they can actually report if a parent doesn't show up for an appointment. So if a parent doesn't show up to the school-based health clinic for an appointment, are they going to report that? These are the kinds of questions I think you guys need to have answers to before, because as I read this bill, the analysis says that you're going to give approval to these clinics in the state of New Hampshire. And once that money's available to the schools, it's free money. We have to do this. And then when it runs out, what happens? So I understand what Senator Prentice brought up about trying to get to people who need health care. And that's a concern I think everybody shares. But I do believe that that's where the Medicaid expansion, that's where we reached out to those people and made sure that people are covered in those situations, so they can seek it. But, I had a nurse ask me, what about the person who's working in the school? This is school hours, so the doctor's office is open. And anybody who has a relationship with a primary care physician knows that they can get their child in to be seen normally that day. How are they conversing? How are they sharing information if a child has, something in the medical records? Okay, the parent might come in, but the parent doesn't know if a medication conflicts with a medication that their child is on. Maybe they forget, maybe they don't understand to tell the school-based provider that this is their medical records. I don't know. Do they have access to all these records? I just think it's such a humongous thing that you are doing that I just see so many problems. I am seeing problems with the school-based health clinics in other states with thwarting parental consent and parental rights, that they couldn't even get the vaccines right this year. They didn't get the vaccines right this year. Now you want to open a whole clinic. I mean, one experiment on these kids and it failed. It failed.
Quick follow-up. So again, my concern is this: they're happening, they're here,
Yeah.
right? And they're under no regulatory requirement whatsoever, including parental consent guidelines, having the parent present during
Sure.
treatment. Should we ignore that and let that continue?
I actually
Or-
like that provision.
Well, I understand that, and this is what I guess my point. My point is that I think that this is the first step into putting some guardrails around it, and the first most important thing is make sure the parent's present and involved. And I think that's what this bill targets, is making sure the parent's involved in all circumstances. The parent's not present, the child gets no treatment. End of story. And so my concern is that would take the 4 that are currently running unregulated and go and doing whatever they want because we have no law in place.
Right.
It would constrain them to make sure that services are done only with parental consent until we can figure out what to do.
Sure. So Senator Ward has a bill coming forward that is a parental consent bill on medical services. So I think that bill doesn't give approval to school-based health clinics, but does exactly what you're looking for, exactly saying that this has to be done if you're going to do this. But we're not, as a state, we're as a people. I mean, I don't even know anybody who supports this bill other than the sponsor. As a state, we're not going to turn our schools into medical-based clinics because of this numerous problems and everything. So I'm with you, and I appreciate that it sounds like maybe everybody's with us in terms of making sure parental consent is there. But again, I go back to the 2 children in New Hampshire where parental consent was required for vaccines, and 2 children were vaccinated when their parents said absolutely not. I mean, I looked at one of the consent forms, do not vaccinate my child. I mean, you can't miss it. They didn't look at it. They could not have looked at that form because it wasn't a question that they did not want their child vaccinated. And nurses were giving that vaccine, if I'm not mistaken. I think registered nurses were giving that vaccine. And I'm not opposed to vaccines. I'm just saying that,
Right.
we had that situation, and this is what happened. And I don't know if you were in the room either when I brought up in Stroudsburg, Pennsylvania years ago.
Yes.
Okay,
Yeah,
I won't
heard
repeat
this.
that.
Thank you, Madam Chair. Thank you, Anne Marie.
Thank you, Senator Ward. And, thank you for continuing to take our questions and, providing
course,
clarification as well as helping, me clarify some of the questions that I have. So Medicaid expansion's been brought up twice now, and I've kind of pushed back at that. I'm trying to understand, there is Medicaid to schools, which is
True.
a program run under DHHS.
Yes.
So is there a particular intersection of this with expansion? I mean, it looks like it already existed for children that were eligible, but some of it has to do with IEPs. I mean, it's not strictly clinical. Yeah, so it's uncovered another layer for me, but you brought up expansion. Another person who testified brought up expansion, and I'm just trying to understand the intersection of this. Do you have a specific?
Yeah, I'm not sure I understand your question, and that is probably, now you're going to probably delve into an area that when it comes to Medicaid, and how it works, the details, I don't know the details of that, so I probably might not be the person to ask that question.
And so and I appreciate that. Since it's come up twice, I thought I'd ask. I wanted to see if there was something that I was missing, but I'll look into it. Thank you, Emery.
Okay, thank you.
Okay. Thank you very much.
Thank you.
So if there's, what?
To answer a question, that Medicaid expansion comes into play in things like occupational services when a child that's eligible for Medicaid, Medicare, schools can submit for those services. They're now eligible. Yeah, so that's where the conversation comes in.
It's come up twice.
So if there's nobody else in the audience who needs to talk on this bill, SB 343, I'll close the hearing on this one. The next bill is SB 374. It's huh? Oh, it is? Okay.
I know. The little green book.
Waiting for the prime sponsor, Senator Innes. This is 374. Okay. In 103?
LOB 103.
Oh, one, LOB, okay.
We have people signed up to speak.
Hmm?
Do we have people signed up to speak on this?
Yep.
You want me to introduce it for them so we can get some of the other people testifying?
That'll be nice, yeah. Oh, here he is, okay. Senator Innes, to introduce SB 374, right? 374, yes.
Good morning. Again, for the record, Dan Innes from Bradford, New Hampshire, representing District 7. And thank you, Ms. Chair and Senators, for the opportunity to present Senate Bill 374. And this bill grew out of a conversation I had with the Secretary of Education, Commissioner of Education, during the fall months. And a couple of towns in my district in particular are having a very difficult time finding teachers. Franklin is really struggling to get teachers on board and to cover all of their classes. They've even resorted to working with some of the community colleges to get education delivered. It's not a situation we really want to be in. And I asked the commissioner, well, let's imagine that I, college professor for 30 years, wanted to teach in our public schools after I retire, part-time, whatever. Well, you'd have some hoops to jump through, and it would be difficult to get it done. It's a deterrent, in fact, to bringing someone in who might have the ability to teach. I could think about Senator Prentice, for example, teaching something in the health area, right? And there are a lot of barriers in the way. So what this bill does is try to open that up a little bit and enable us to bring in folks to cover courses and programs that are really qualified in the topic area. And I'll just point out a couple of things. A part-time teacher is not required to hold a state board of education credential, provided that they work less than 30 hours a week, they submit to a criminal history record check, they're subject to the same code of conduct and code of ethics as every other teacher and employee in that school. Any person who has had a license and lost it shall not be eligible to teach under this section. So it's not a way to get back into a school if you lost your license, right? So we have that safeguard in place. So I think it's a pretty solid bill that will open up opportunities for folks who can contribute to our K-12 education and will help those schools to address the issues that they're facing as well. I'm happy to take any questions if you have them.
Questions? Senator Lang?
So in looking at this bill, I started thinking about what they used to call specials. I don't know what they call them now, electives basically, right?
Mhm.
So computers,
Right.
art, AP courses,
Yes.
right? Where you may want to bring a specialized person in to teach, but you don't need them the whole day. You need
Content
two
expert.
classes, content specific.
Yep.
And is this bill kind of geared toward including those kind of things that allows
Absolutely.
for an expansion of services
Yes,
for content specific?
that's correct.
Thank you.
Thank you.
I don't see any other questions from us. Thank you very much.
All right, thank you.
Mr. Appleby?
Thank you, Madam Chair. Good morning, Senators. Steve Appleby, Director, Department of Education. Just wanted to answer any questions about this bill from a technical standpoint. One of the programs I oversee is the Bureau of Educator Credentialing. And this bill, as the sponsor noted, is really a reaction to what we're hearing out in the field and is exactly geared, Senator Lang, towards what you're talking about. I had a conversation this past fall with a superintendent in the North Country who could not find a licensed art teacher to teach one period a day. So this would alleviate that issue. And what we have is also situations where a licensed art teacher will work in 3 different districts, part-time in each, right? Because they have the license, but they're driving between districts, sometimes at great distance. So this would allow for that situation to be cleaned up, really, and also not restrict content. Similarly, I'll tell a parallel story very, very briefly. We had an endorsement that we used to issue licenses for called Comprehensive Agriculture Teacher. It was a full-time bachelor's degree requirement to get the license, and they teach agriculture. I had superintendents that were not offering agriculture classes in high school, not CT, I'm talking non-CT high school, because they couldn't get a licensed agriculture teacher. So, and the endorsement completely mirrored what was going on in the CT centers, where they didn't require a bachelor's degree. So working with the Superintendents Association and the State Board, that endorsement was repealed, and I have several superintendents now who are planning next fall to offer agriculture classes. So licensure was actually holding back the programming that could be offered to students, which is not obviously what we want to see. So,
Any other questions? So I have a question. They have to work less than 30 hours. Now, is that 30 hours and could they get away with, if they're teaching in 3 different districts, there's 30 hours in each district?
it's 30 hours per employer.
So somebody's keeping track of those hours.
So it would be the employer. So if they taught 25 hours in District A and then wanted to go teach 25, work part-time in District B, yeah, those are different employers.
Thank you very much.
Yeah.
I don't see any other questions for you.
Okay, thank you.
Thanks. Brian Hawkins.
Thank you, Madam Chair. For the record, Brian Hawkins, representing NEA New Hampshire, here in opposition to the bill as it's written. So I heard that this was a method for addressing shortages, and I completely appreciate that. We spent a lot of time together in the Teacher Shortage Committee over the last couple of years. But I think the way the bill is written, I don't think the question is, do you not need a credential based off of less time in the classroom? So in other words, the amount of time in which a person engages in teaching activities, just because they're doing it less doesn't mean that they're necessarily qualified and have the capacity to teach and have the skills and to teach effectively. Licensing by the state is one of the ways that we can help assure that a person does have the requisite knowledge and skills to do the job. So if all you need to do is work less than 30 hours, I saw the other provisions in the bill. Does that work the same if you're talking about other professions? So if you're a surgeon and you perform surgery on a part-time basis, do you not need to be licensed to be a surgeon? Same in other professions, an electrician and so forth. Putting people in teaching positions without the requisite knowledge and skills, I don't think will end up helping students. We do have other pathways to certification, as I think Mr. Appleby mentioned earlier, and we talked about in the teacher shortage committee. But I think focusing in on less than 30 hours a week is what we ought to be focused on, is trying to ensure that these jobs are more attractive because they are paying well, because they have good benefits, and people can have a career in education. A couple of questions on the bill. Does it include certified paraprofessionals? It says teacher, but sometimes when we're talking about... What-
Left.
1 minute?
1 minute left, yes.
I'll get there. Also, part-time, there's the loss of prep time there. Also, there are regulations around when you're talking about executing an IEP. There are regulations around certification there. With respect to the code of conduct being one of the items, with no certification, a question we would have is how can you enforce something under the code of conduct if there's no action that can be taken on their certification or their with respect to their license. So I'll wrap up. Instead, like as I said, instead I think we should be focusing on raising pay, investing in teacher recruitment and training, and improving working conditions in schools. And that will, as we talked about in the shortage committee over the last couple of years, we have a number of ways that we can do that and ensure that we have high qualified educators in our classrooms. Thank you for the time and happy to take questions.
From the committee members, Senator Lang.
Thank you. Thank you for taking my question.
Yep.
So I'm going back to the idea of specials, and we heard testimony that, again, our teacher teaching one class a day in 3 different schools because it's the only way to get art into the program. Absent that kind of model where we allow for, I'm thinking like a retired CPA who might teach an accounting class at a high school, and yet the school would never hire that person as an FTE because it's not financially feasible. It's not good for the taxpayer. It's not good for the citizens. Not good for the students. So how do we deal with that?
Yep.
How would you, to be fiscally responsible, if you have 1 accounting class a day, justify that with an FTE?
Well, there are school districts that employ part-time teachers, and there are also school districts that have the option for a job share, for example. So it's not that we can't do this now, that there's a prohibition on teaching in schools part-time. It's just our issue with it would be, is this bill enough to ensure that we have high enough standards for whoever that person is coming in part-time or full-time, for that matter? Are they high enough to ensure that that person not only is content knowledgeable, but also understands the pedagogy of learning? And I think the bill, as it's written here, doesn't do that.
Follow?
Follow up?
So again, but don't you think the hiring authority has that responsibility? That doesn't need to be at the State Board of Education. The school board who's hiring, or the SAU that's hiring an accountant to teach an accounting class is going to interview and go through and pick the best candidate they feel is able to do that. But that's the local hiring authority's responsibility, not the State Board of Education's responsibility.
Well,
So it's already being done.
I think there's 2 different responsibilities. There's the employment responsibility. Is this person a good fit for the school? But I think we have, as I stated earlier, part of the reason we have this licensure certification process is to help ensure that we have a qualified pool of people for which those administrators can choose from in order to hire them in the classroom. And so I think there's a lot of work to do to hire somebody in there. I think this is so having these standards, just as I said, just like in other professions, it's important to have those there so everybody has an understanding in terms of what that person has gone through in classroom experience, and that's critical. The other thing I would say too is if we want people to be in schools and have some consistency, even if they're part-time, the folks who have not gone through the process of classroom, the rigor of the classroom, those people tend to leave at a much higher rate. I'm happy to share a study that was done on this relatively recently about uncredentialed teachers leaving at double the rate that someone who was licensed. And so I think that's important too. If we're just cycling people in and out, that's not helpful from an administrative standpoint either, because you're constantly in a hiring process.
One more follow-up. So again, I'm not quite sure of your answer there. Is the school board incapable of determining what a good teacher is when they're hiring locally? Absent the certification process, you're saying they're incapable of defining what a good teacher is and what a bad teacher is, absent the state certification?
No, I'm saying it's helpful to have an understood, when you're hiring, an understood set of skills and experience from the pool of people that you're hiring from, because you're not just making widgets. And so I think having these standards are important, and it helps the school board and the administrators, again, hire qualified individuals in the classroom.
Thank you very much.
Thank you.
Michael O'Brien.
Thank you, Madam Chair, members of the committee. My name is Michael O'Brien with Party Strategies here on behalf of AFT New Hampshire. President Howe is going to be here this morning, so I will do my best to fill in, although I'm certainly happy that Brian Hawkins was before me. Here to testify against this bill today for many of the reasons that he just stated, which is to say that we do believe that being a teacher is more than just knowing a content area, but knowing how to teach and how to effectively reach students. I'm a creature at this point of this building, have been it for about 15 years. But if someone asked me to be a political science teacher, I don't know if I'd be a good one. And I say that with love to my wife, who is a teacher, and who I see every day do work that I just don't think I have in me to do in the same way that she does. And so this bill is written for up to 30 hours a week. A full-time teacher can sit somewhere between 37, 35, 36, 37 hours a week. You're running pretty close to allowing someone to be full-time without being full-time in this bill as well, which is a concern. So I really just think for student learning, as was pointed out, there are opportunities for teachers or for folks to come in and teach an agriculture class or maybe a CPA class right now without approaching up to 30 hours a week. Doing these one-off at schools hire part-time teachers already. This feels like an expansion of that, and one that I think could hurt children in their learning in the classroom. So that is my testimony, and I'm happy to take any questions. President House did send in testimony as well, which is probably more thorough than I can be, as she has a great understanding of this certainly than I do, but happy to take questions as I can.
Questions? Senator Gendro.
So I'm just thinking, thank you for taking
course.
question or comment. It may be a combination of both.
Sure.
I guess I'm going back to what has been said as far as specialized and what Senator Innes said as far as more maybe one-offs or specialized. quite a few years ago, the Dale Carnegie system, and for those that are familiar with this, the How to Win Friends and Influence People, I was certified as a instructor several years ago, and they wanted to bring it into the school system. And so they designed a program for the school. And I'm thinking, what a great thing, you know, how to stop worrying, start living, how to get along, team, the whole package is amazing. So they designed it, and then they wanted to bring it into the high schools or the school system, and was told that it had to be a teacher to do it, who was not a certified Dale Carnegie instructor, to teach that, or to bring a certified Dale Carnegie instructor in, but then had to jump through all the hoops of the New Hampshire certification. So I'm seeing it as something like that, as just a program to bring in, because being a certified Dale Carnegie instructor, standing in front of 44 people is not easy either. So for a teacher, I mean, and I can see the value and the argument on both sides, but I would love to see this program do just that. The special types of programs. And as it turned out, the reason why we couldn't go forward with it is because it fizzled out. Who, you know, certified Dale Carnegie instructor didn't want to go through the hoops of being certified as a teacher in New Hampshire, and vice versa for the teacher. And I can't imagine, especially in today's society that we're living, I'd love to see that program get into the high school, to help our students, teach them how to win friends and influence people. But thank you.
Thank you.
Senator Lang?
Just a quick question. Did I hear you say that a full-time teaching position is 36 to 37 hours a week?
I think it's probably 37 and a half. I mean, I would have to, I would say I should rescind that because I'm not 100% sure of that number, but I think it's around that. Obviously that's in school hours only, right? And so that's not the, 50 hours a week. I see my wife grading papers at night. So
Follow-up?
Follow-up.
Can you tell me what advisors and coaches get for certifications at the school board in order to teach kids sports or teach a special after school? Is there any certification process for that?
I don't want to steer wrong here, so I'm unclear, and I wouldn't want to say anything incorrect here.
Thank you.
Apologies.
Senator Prentice?
Steve Appleby's here. Would he know?
Can you answer that question?
Just gonna
Mr.
put you on the
So
hot
again, the
seat.
question is around sports and after schools, they regularly have no certification required to teach a kid football, baseball, soccer, nothing.
Of course, those are voluntary, right? You
Thank
sign
you.
up for those. They're not part of required course curriculum, so.
Senator Prentice, did you have another question?
No.
Thank you very much.
Thank you.
Anybody else in the audience who likes to speak to 374? Mr. Appleby?
Thank you for having me up a second time. I just wanted to, A, answer a couple questions about certification, expand, and then B, Mr. Hawkins brought up a couple of items that I wanted to also clarify. Paraprofessionals today are not required to hold a license from the State Board of Education unless there are certain circumstances around special ed law where they need to have a license, but they are not required. Many paras are already part-time. 1, 2, the word teacher was very intentionally used. Teacher means a classroom teacher. It does not mean an administrator. It does not mean a specialist, for example, a math specialist. It strictly refers to the teaching positions. And lastly, we do not license athletic directors. We do not license after-school coaches. And what we do see happen, I neglected to mention this the first time I was up, we have an administrative rule called the minor assignment rule. Minor assignment rule allows an educator to teach outside of the area that they hold a license, as long as that doesn't exceed 50% of their workload, or their work week, I guess is the rule. So if I'm a math teacher, I can get minor assigned to teach art as long as it doesn't exceed 50% of my hours for the week, even though I don't hold an art license. So that's currently in administrative rule. So.
Senator Prentice.
Thank you, Senator Ward. Steve, thanks for coming back up. Totally, well, kind of out of left field here, but substitute teachers, how, do they have an hourly limit, like that they can,
20 consecutive days,
20 consecutive days?
In the
but
classroom.
Hours per day, like,
no limit.
okay, so they're 20 consecutive, but they could be broken up? Okay, second follow-up. Okay, so now I'm gonna swing back in another direction. Subject matter experts, specialty, specialty educators, not special ed, but content, say subject matter experts brought in to teach a specific topic. There isn't an avenue for that now?
No. So if they were brought in for 1 or 2 days, for example, let's say, because they're a specialist in forensic accounting, going back to the accounting example, and this class touches on forensics accounting, maybe for, one lesson in one module. So they bring in a special person to talk about it for the day. That's not prohibited. That person isn't licensed because it's, it's a one-off. It's not. The idea here is regularity, having that same person at the front of the classroom every single period.
Just a statement. So when it walks like a duck and it quacks like a duck, it's a duck teacher.
Correct.
Okay, thanks.
So again, I think you said this, but teachers are defined in statute. and
They're
that's
defined
why-
they're defined in administrative rule
Rules.
that governs the licensure process.
Great.
Yes.
And it doesn't include things like paraprofessionals.
Does not include
occupational
paraprofessionals.
occupational
No,
therapists and those,
oh,
they're all outside of this,
all outside.
this this law, this
That
bill.
would be the intent. Yes.
Thank you.
Thank you very much.
And I'm going to drop a study off as well that
Okay.
you might find useful regarding licensure and emergency licensing.
Great, thank you very much. Anybody else who needs to speak to Senate Bill 374? If not, that closes the hearing on this one. Now we go to Senate Bill 376, and I think we have the prime sponsor here.
Good morning, Madam Chair and members of the committee. Good to see you with a nice snowy background behind the committee members. I'm Senator David Waters, District 4, to introduce Senate Bill 376 relative to establishing a corrections education vocational planning group, which is exactly what the bill does, establishes that group. Let me give just a brief background as to why this bill has come forward at this time. This bill was prompted by work by the New England Board of Higher Education. I know many of you are familiar with the New England Board of Higher Education. It's been around for 65 years, established by the 6 New England governors, and it provides the 6 states great opportunities for coordination. The tuition program for New Hampshire residents gets us about $3 or $4 million a year of value, but the other great value of the commission is able to coordinate policies for the 250 universities and colleges, particularly transfer credit, availability of programs, and also trying to advance good post-secondary outcomes for our citizens to build a good workforce. A commission on the future of higher education in prison was formed after the United States Congress passed a bill which allowed the reestablishment of Pell Grant funding for incarcerated people, which had been ended in the 1990s. In retrospect, a great mistake, but that funding opportunity is back, so it means the 6 states need to plan for how we can establish educational programs for incarcerated people, taking advantage of that funding that is now available. So a commission was established in late 2022 by the New England Board of Higher Education, working with the Ascendium Education Group under some substantial grant funding. and that body met. I was a member of it. I have sent you all an electronic version of the final report, Partnerships for Progress in New England, a student-centered approach to higher education in prison. And that group included our people, representatives from New Hampshire. I serve on the board of NEBI, so I was one of the members of this commission, but we had community college system, the university system, good participation and endorsement of this effort from Department of Corrections. And so the report identifies the great advantages of education for incarcerated folks. We see increases in facility safety because there are good programs for incarcerated people to take. We see a great increase of public safety, since vast majority, 95% of incarcerated folks are going to return to their communities, and people who have undertaken an educational program while incarcerated are 43% less likely for recidivism. And that's just a huge advantage for those individuals, but also for our prison system and for public safety. Self-efficacy, these educational programs help individuals to see that they can take control of their lives and have better outcomes once one released, greater self-esteem, reduced feelings of loneliness, depression, and then intergenerational impacts. This helps the families of these individuals as well. And then employability. We have such great workforce issues. And I will tell you that businesses in this state are very interested in apprenticeship programs and ways of connecting with individuals who are incarcerated or will be released having had some education that they can do. So essentially what the bill does is it takes the policy recommendations from this report and empowers this group, this planning group, to work on solutions that will work for New Hampshire. You can see here the members of this group who have all agreed to be part of it, and then a couple of sets of duties. First, to certainly consult with the other states and departments of corrections and the New England Board of Higher Education. Having gotten to know through this process the directors of the Departments of Corrections in other states, terrific group. Maine is a really good model of how education in prison can work. There are other models from other states, particularly I think of Connecticut, Massachusetts in particular, that we can benefit from coordinating with and understanding. And also New England Board of Higher Education is anticipating getting an additional $4 million grant for this, which will be able to provide some funding for perhaps technology needs or for planning needs to the 6 states involved. So that grant is not in hand, but I think there's a sense that there's a follow-on to the funding that was provided for this planning effort, that they want to put, there's desire to put more funding into it. So I won't go through all the policies, implementation strategies, and funding needs, but you'll see this kind of list here. Again, these are drawn from the results of that study. How we're going to have sustainable partnerships. I will say that 2 of our community colleges have already stepped up to do education in prison. So we have some programs that are developing, and this will help ramp that up. We've got to deal with issues of credit transfers and how to make sure that people going through these programs while incarcerated, those credits will work well when they come out and want to continue a community college or in a university system. We're going to do some college readiness programs for individuals. Some of our adult learning centers are doing this already. And then we're going to look at what might be able to do to have courses that are being offered for incarcerated population in other states available electronically to people in New Hampshire. And then the Commissioner Hanks was particularly interested that we also focus on vocational needs, meaning we're going to have that interconnection with the businesses in the state about what kind of actual vocational needs. So you'll see starting on page 2 here, take a look at the market needs and demands skills and the credit alignment that is needed to provide those skills through education in prison, and then look at what we might need to provide appropriate classroom space, library space, and technology needs. Have had some good conversations with the people who are attending to these things in our state corrections. As I mentioned earlier, work-based learning and an apprenticeship. And then what might the barriers be upon release? A lot of individuals go through this program when they get out. They have food or housing or transportation needs, so it's good to start to coordinate with the folks in the correction department who look at post-release services, that we can have some coordination so the education can successfully continue. And then, of course, the most important in some ways, F and G, look at the Pell Grant funding, potential for supplementing some of that through the university and college system, as we do now with the Granite Guarantee Program for Pell Grant recipients. And then, other funding sources. I mentioned a $4 million grant, but I do believe there's pretty substantial money that's coming down for prison education programs besides Pell Grants from federal sources and other investments that we might be able to make there as well. So that's the group. It'll give us some reports and do, I think, what will be a real benefit for the workforce of New Hampshire and for incarcerated people as well. Thank you, Madam Chair, and glad to take any questions.
Questions from the committee members? No. So when is this going to start?
Pardon?
When is this program going to start in New Hampshire?
I think we'll have some more detail from other folks here, but there is already an agreement in place. I mean, there is some education in prison taking place already. And we might hear, depending on with the snowstorm, who's been able to arrive to testify. There has always been, and there is some underway now. As I mentioned, with the arrival of the Second Chance Pell Grants, 2 of our state colleges, community colleges, have stepped up to coordinate offering more programs as the money is now coming. So that's why this group will make sure that as the money is becoming available, that we can provide more than has currently been provided by those who have stepped up to do it.
So this is a study group. It's
Right.
not a commission and it's not a committee.
No.
So, and the first report I see here is going to be on December 1st this year. And then annual reports are going to be filed. So who is responsible for writing getting the reports, and who in the legislature is getting the reports?
Yeah, thanks for your question. And the Commissioner of Department of Corrections or designee will serve as the chair. And so whether it's Commissioner Hanks or someone she designates will be responsible for running this group and getting that first report ready. I put that date there so it would tee up any considerations we have for the next budget. And I think we are probably going to need to make a few legislative tweaks as the programs develop over credit transferability and some of those things as well. So I think we will by December 1st get some advice there. And the report goes kind of boilerplate there: Governor, President of the Senate, Speaker of the House of Representatives, and the organizations listed in the membership. So that's who the report will go to.
Thank you.
Thank you.
Kristen Miller.
Hi, good morning. My name is Kristen Miller. I currently serve as the Vice President of Academic Affairs at White Mountains Community College, which is part of the community college system of New Hampshire. So I'm here on behalf of the CCSNH and White Mountains. We have been fortunate enough to have been approved to offer prison education programming under the Second Chance Pell Experimental Site Program. We were approved for that just about 2 years ago and started our first cohort of students. in the Northern New Hampshire Correctional Facility a year ago, March. We have a total of 35 students now taking classes towards either a business administration or liberal arts degree. And we've been working closely with our colleagues at the University System of New Hampshire for transfer opportunity upon whether they're still incarcerated or upon release. We have been extraordinarily grateful for the partnership with the Department of Corrections as well in terms of offering the program. And I will say offering prison education programming does not go without challenges. So the idea of having a variety of stakeholders working together for planning, evaluating, and looking at what could be available for resources, partnership support for prison education program, I think would be extremely beneficial to the residents and to the state. One of the reflecting upon the past year, a number of students that are currently in the program have said, we tried to advocate for something a couple of months ago that I believe it was additional recreational time. And they said it didn't go very well. But after we took our first college composition course, we were able to then go back. We learned how to communicate differently. We learned how to communicate effectively. And they went back and advocated, and they did it well and were able to get what they needed. So not only are the programs assisting in, post-release and building their future, but also while they are inside the walls and being able to advocate for themselves, creating a safer environment, working towards a better future. So we also had an opportunity to weigh in on the draft of this bill, and we thank the sponsors for that. And I'm happy to answer any questions that you might have.
Questions? So these are 35 students working on the college degree.
We do, and we would like to continue to take on more students. There's, I believe, about 500, and not all of them are eligible, but they are knocking on the doors to get into the program. And so the idea of identifying some resources is important. We are doing it with our current resources in terms of staffing. And so we're continuing to find ways to advocate for the program.
Do you have any who have finished and are out in the community?
Not yet.
Not yet,
We
okay.
have the first cohort of students. We started with 21 students. 2 of them had to be transferred for medical reasons, so they weren't able to continue with the program. But since we started, we still have 19 students, which is an incredible retention rate for the first cohort. There's about another semester or so until the first few students who came in with some transfer credit will complete. And so we are in the process of thinking and planning for a commencement ceremony, which is really exciting.
Yeah, that should be very exciting.
Yeah.
Yeah. Any other questions? Thank you very much.
Thank you.
Nicholas Duffy?
Hello. Thank you for allowing me to speak today. My name is Nicholas Duffy. I'm the Director of Rehabilitative Services for the Department of Corrections, and part of my division oversees education and vocational training for the state. We strongly believe in education, and we support this bill. Not only will this help with ensuring that all the stakeholders are together and bringing those barriers forward, it will also ensure long-term success of the program, no matter whether there's people leaving positions or changes. That group will help solidify that group and make sure that we're year after year bringing challenges forward, so that we can continue long-term success of higher education in prisons. As we know, it's extremely beneficial to lower recidivism, to ensure that people have the best chance of success upon release. And so education is something that we feel strongly about, and feel that this group is only going to help push those agendas forward. We do have 2 small changes that we feel like would be helpful in this bill as well. The first would be to add the executive director or designee from the Office of Professional Licensure. And again, that's with vocational training. If we can get licensure for any programs, if we can get them licensure before release, that or working on that before release, that's a huge benefit for the job market, as Senator Waters was saying. And then the other small change would be to add a designee for the Director of Rehabilitative Services, so the Commissioner can appoint the Director of Rehabilitative Services as their designee to serve as the chair, and then the Director can appoint another member of our team. Again, thank you. I really appreciate
Any
this.
questions from the committee members? Seeing none, thank you very much.
Thank you so much.
Is there anybody else in the audience who would like to speak to 376? If not, this concludes the testimony on Senate Bill 376. So the next one is Senate Bill 441.
Thanks so much.
And I think
Give
we
my
have
best to Helen, please.
the prime sponsor here, Senator Waters.
And I'm sorry, Madam Chair, this one is which number?
441.
Okay, I'm a little discombobulated, trying to be at had three bills being at
It's an
at
advisory
the
group.
same time in different committees. Thank you so much, Madam Chair, members of the committee. Senator David Waters, District 4, introducing Senate Bill 441 relative to establishing advisory group to examine potential funding sources for career and technical education, construction, and renovation. And we have Jeff Beard with us today, and I'm going to talk for a little bit, but I'll let him get into some of the more details about this. What you can see is the bill established an advisory group to look at the whole issue of funding sources for career and technical education, construction, and renovation. You'll see the members here. And I'll explain why we have some of the community college folks here. But the duties, feasibility of joint or co-located CTE programs with the CCSNH, and a report of its finding and so forth. Now, as a background here, it's kind of twofold. One is, as a member of Capital Budget Committee, we, and every 2 years have proposals for the renovation or construction of career and technical education centers. And there is federal funding that comes through the Perkins program that comes into the CTEs in each of the states, and we get our share of that. We've been on about a 20-year cycle of funding the renovation and sometimes reconstruction or new construction. We also periodically, there is a need for a particular program that comes forward and needs to expand or needs some more facility space or equipment. We're approaching the end of the 20-year cycle in terms of the moving around the state and, who's on deck to get funding, and pretty much I see the end of that cycle. And so the question began to arise, well, what do we do next? Is there a way to be more nimble with this funding? Is there a way to look more closely at what the needs are, in particular technical and other areas? Recently healthcare has been big, construction, trades. I mean, we all get the reports of where there are workforce shortages and what areas are growing. We passed the bill last year about offshore wind and offshore wind trades and techniques. So that, the economy is shifting and the needs are shifting as well. It also seemed to me that there could be some real synergy about coordinating with the community college system and its construction, because it might be possible to have some facilities at the community college campuses that could be used not only by CTEs, but also by other people who were enrolled in degree programs at community colleges, which also get them people certification in certain CTE fields as well. And there was considerable discussion last year around Concord High School and the technical institute, because there are some programs, and the the issues about land and funding for all they need to do because they're bursting at the seams at the Concord CTE. But I've thought also up in the North Country as well, there's, particular synergy there about whether or not you could have these vocational and job training programs and facilities shared. There has been a pilot program this past year of, I'm trying to think, this is after hours CTE, in which these, the CTE centers have welcomed in people from unions, from businesses to come in and use the facility at night for the training of their workers. So I think that this would be a way to save us some money and to better coordinate. And I particularly talked a lot about this possibility of being more nimble and innovative with Commissioner Adablu. I mean, since he arrived here, we've been talking about, aren't there ways we can better coordinate, have some efficiencies, and see if we can't not just do business as usual, think a little bit outside the box. In this case, the box is the CTE center, and how is it that we might use this construction program to think more innovatively and fulfill the needs of our students, but also the needs of our employers. A number of years ago, Representative Ladd and I passed a pretty comprehensive bill around CTE that set up the CTE advisory group, and it has taken a couple of passes at this issues over the last 5 years because we saw coming down the road the end of this 20-year cycle coming, and we had some kind of informal studies about what to do. And so it seemed like the timing was right to really bring forward a bill now and to have it look at these particular issues, and in particular that coordination with the community college system. So that's what this group will do. My hope is that we would have some good advice, by the time we're doing our next capital budget, because that's when we're going to have to start looking at what are we going to do about funding for CTE construction and renovation. But I do think it's going to be an ongoing issue. I really think the potential for New Hampshire here is to be kind of much more creative about how we do our job training and that coordination, that seamless credit transfer. We're doing a lot of the dual and concurrent enrollment, so these CTE students are maybe spending most of their senior year now taking community college courses. So they're getting an incredible leg up, saving a lot of money and boosting our workforce. So thank you, Madam Chair. And as I said, a lot of the details can come from Mr. Beard.
Okay.
But if you have any questions, I'll try to answer.
Senator General?
Thank you. Thank you, Senator Waters. I just love this anyways. I really do, because of course in Littleton, in my district, we've got Burndy, we've got some organizations that definitely use this, the CNC machines that they went to the CTE after school, well, after school was out and in the evening, so that they could train their employees. But I'm thinking too of additional funding. Could you see this with these organizations like Burndy or some of the I can't even think of any others right now that would be able to fund, to be able to get the machines, maybe to help with the construction or repairs or whatever. Because it's such a great program.
Yeah, thank you for that question and pointing out that possibility, because yes, I think there is a great interest among employers and manufacturers in particular about coordinating and being able to have, if you have a student training on your machines at their CTE, guess what? You're going to hire them. Val Zanchuk, who has been a kind of a leader in this kind of coordination and what he's been doing with the CTEs, and he's on this advisory group as well. A few years ago, we passed legislation to establish a tax credit for businesses who make donations, not only of equipment, but this is unique in the country, but of employee time to instruct our CTE students. And so that is, I think, a pretty generous tax credit program. There's been, good development of using that, but I think that manufacturers and other employers are really ready to step up and help support our CTEs.
Thank you.
Okay.
Any other questions? I just have on the A here, I was not aware that we had a state director for CTE. Who is that?
Ta-da!
You are the state director for all the CTEs?
Yes.
Okay, that was nice to know. I didn't know there was one.
And he's doing a great job, may I add.
That's my question. I don't think we have any more questions for you, Senator
Thank you.
Waters.
Yeah, Senator.
Senator Lang?
There's no citizens on this panel at all. Regular, average taxpayers, citizens. Is that by design, or is that should we include an average citizen to be able to speak about what's going on in CT and communities and have a different perspective other than just a bunch of professionals already involved in that discussion?
Yeah, thanks for the question. And you know, I considered a lot of options, but I thought there was a kind of because of the targeted nature of this, and that in terms of citizens, you know, the town meeting or the council will be deeply involved in any actual projects that are proposed. And I'm sure that Mr. Beard will tell you about how we have our partnerships. Each CT has sector partnerships which bring in citizens. So I think they'll get good advice. And it would be awfully hard for me to think of one person or a citizen. And I think they'll really, they're well connected with citizens. But you know, it's up if the committee would see the wisdom of that. You could have a citizen selected by state director of CTE, or maybe by the governor, or I mean that takes some time, but or maybe by Commissioner Adeblu. You know, I mean I'm not opposed to it. I wasn't really sure that it was necessary for this type, but it's up, you know, your wisdom, Senator, which is considerable.
Thank you for the flattery.
Thank you very much.
Thank you.
Now we're going to have the state director of the CTE.
Good morning, Madam Chair. Good morning, members of the committee. I'm Dr. Jeff Baird. I'm the State Director for Career and Technical Education. I work in the Department of Education. I'm also the Administrator of the Bureau of Career Development. And I want to take a moment to just thank Senator Waters. He really is a champion for career technical education in the state. And introducing this bill is a great opportunity to have some really in-depth conversations. And Senator Lang, to your point, we always want to involve members of the general public, and because they are decision makers and stakeholders at the local level. I'll talk a little bit in just a moment about how that involvement will happen, I think, organically, but also some ways we can more purposefully make that happen. So just as a little bit of background, Senator Waters has always laid out the intent of the bill, I think, beautifully, but the renovation queue that he mentioned a few times, it's found in the administrative rules for career and technical education. It began with the Cheshire Career Center in Keene, I believe in 1992, the current queue. And the very last center that's on that queue is Milford, which is up in the next biennium. They're developing their application right now for CTE renovation. Historically, the legislature has generously funded each biennium. They've appropriated funds to renovate 2 career and technical education centers in high schools. One of the challenges in renovating an entire center at once is really there's 2 factors to it. The first is that there can be a considerable burden on taxpayers to come up with. The legislation allows for up to 75% funding by the state. Helpful. That remaining 25% has to be come up with typically in a bond warrant article by the local community. So if you think a renovation project could be in this day and age upwards of $30 million, coming up with a quarter of that $30 million is a considerable thing for the taxpayers to consider. Looking at some other ways to approach this funding and ways to proceed with CTE renovations, if there was an option to renovate spaces rather than entire buildings, a community might be considering 25% of $5 million rather than 30. Senator Waters also had mentioned that it would allow things to be more nimble. So for that community involvement, employers are always highly important. And in some ways, I wish rather than CTE or career technical education, I wish it was called CFE, career focused education, because ultimately the purpose is to get young people family sustaining work in the state of New Hampshire, and ideally in the communities that they live in which they live. We know that young people are excited about engaging and becoming part of the economy in the state. We'd love to keep them here, not have them go elsewhere. But I think that looking at the possibilities of renovating individual spaces rather than entire buildings might be a creative way to be responsive to industry needs. Think about the automotive industry, for example. Electric vehicles have just taken off within the last 5 years. Most of our CTE automotive programs were built between 15 and 20 years ago. The ones that are current, that have been renovated within the last 5 years, have spaces that really closely resemble an auto dealership. When you walk into the service area in an auto dealership, our high school CTE auto program looks just like that. But if EV continues to be a major part of that automotive sector, these spaces will need to have some renovation, have some additional equipment. And if you have to wait for 20 years to have your entire CTE center renovated without assistance from state funding, that might not be something that's a possibility. The other possibility is this blending and blurring, so working more closely with high schools and the community college system of New Hampshire. There's already a great deal happening where high school career technical education students are earning college credit from CCH colleges while they're in school. And there's some opportunity just looking at the physical buildings. Senator Waters had mentioned Concord. Now, Concord High School is essentially on a couple city blocks right here in the city. They have no way to move out. They could only move up. So if they were able to maybe partner with CCSNH, NHTI has a lot of space on their campus and also has a strong interest. I know that the Chancellor Rubenstein is very interested in having more young people experience what CCSNH has to offer. And as they do that as high school students, that it gives them that experience and that opportunity to be on the campus. So I just threw a lot at you very quickly. If you would like, I'm available for questions.
Questions from the committee members? I guess you did such a good job.
Thank you very much.
You don't have any questions. Anybody else in the audience would like to speak on this particular one, 441? Seeing none, that closes the hearing on Senate Bill 441. Now we have Senate Bill 338.
Thank you, Madam Chair. Senator David Waters, District 4, and this is Senate Bill 338 relative to the Education Professional Standards Board. This bill comes forward because of an interest, particularly from the career and technical education side, of pointing out the kind of really, I think, almost oversight of not including someone from this area on the Professional Standards Board, because it is education regarding professional growth, certification, and governance of the education profession in this state. So the bill would add to it one member, the administrator of the Department of Education, Bureau of Career Development, or designee. Now, Mr. Beard, who you just heard from as the director of the Career and Technical Education Center, actually serves under the Department of Education, Bureau of Education Development. So the recommendation from the department was to phrase it this way, that administrator or designee, and the understanding would be the designee would probably be CTE director. So as you know, CTEs are a large part of our educational effort in the state and are very directly involved with professional standards and certification for students and the education that's provided, so they can get out there and have the credentials they need to get the jobs in our economy. So this would be, I think, a welcome addition to this board, and that's what the bill will do. Thank you, Madam Chair.
So you're just adding one person to the board, or that's, because I was looking at the number of people, there are 22 on the board.
Yeah.
And I heard there was an awful lot.
Lots of cooks and lots of spoons, but you know, that reflects, thank you, Madam Chairman, doesn't that reflect the diversity of interests of education in our state? I mean, the state, I mean, New Hampshire is really quite unique in some ways about how many people have expertise that are involved in different ways. And we like that. And I think it's, you know, one more spoon, one more cook, I think we'll have a little better soup.
Well, as
So,
long as you can coordinate the work, the meetings, so that people can have a chance to talk and not go on forever.
yeah.
Because with 22, 23 people, that's, you know, that's a pretty big board.
Now, I will say, you're saying talking and going on forever while you're looking at me. I get it, okay? It's okay. I'm going to be brief. Thank you, Madam Chair.
Any questions from the committee members? Not having any questions.
Thank you.
Anybody else wants to add anything?
If I may say, I'll get language about the potential additions that were requested for the previous bill, and they'll be emailed to you
Okay,
from corrections, okay? But I've got to dash to the other committee, but if any further questions after the hearings.
okay.
let
Thank
me
you
know.
very much.
Thank you.
That closes the hearing on 338, I think it is. Yep. We can go into executive session.
10-minute recess within office.
Sure. Yep. This closes the public hearing on the Senate bills. We are taking a 10-minute recess. Where would you like to go?
It's one of me. I'll let you all hang out.
Well, yeah, with Suzanne is here also, so.
Speaking to the mic.
Aye.
Aye.
Aye. Aye. Thank you. Okay. Let's see, so we start with the ones from today or what?
So Madam Chair,
Do you have them?
I'd like to consider the first bill, bill number 1 on our cheat sheet, Senate Bill 338.
That was done today.
One we heard today.
I know, it was the last one we heard.
Yeah, the one we,
on the sheet.
yeah, first one on the sheet,
Okay.
last one we heard.
Okay, that's the one to add a member to the Board of Education Professional Standards. Okay. We'll
So
have a
Madam Chair, I'm
motion.
inclined to an OTP if someone would make that motion.
Motion to OTP.
On 338.
338, OTP.
Okay, so we have a second, All those in favor?
Aye.
Aye.
Any discussion on it? Okay, so that is OTP on 338. Who wants to take it out? Or do we want to put it on consent?
Yeah, move consent.
Second.
Give it to, otherwise,
Consent.
my colleagues and general.
And who wants to take it out?
Take it out.
Benton will take it out. Okay. 338.
Madam Chair,
Yes.
I'd like to move on Senate Bill 343 interim study and speak to my motion. If I get a second.
Did
I'll
we do
second
that
it.
one today?
Yes.
Yes.
So this is relative to school-based health services. And there's some, one of the biggest concerns I got was the conversation around malpractice that we just kind of skimmed over, but I'm a little concerned that if we put this into law, we might be dealing with an issue of malpractice around schools and doctors and who owns that for healthcare that's provided. We heard the conversation around the vaccines that were given, even explicitly against parental consent. Yeah, even so, that's two potentially huge major lawsuits on a malpractice matter. So I'm concerned about that until we can have a better definition of what that looks like. And I don't want to kill the bill outright because I think it has merit. But I also don't want to pass a bill that says this is okay either until we can figure out some of those things. So I'm going to move it on.
Senator Prentice.
Thank you. So I mean, I largely agree with the nature of this, because of access in rural areas, and so rural and underserved areas. I think that this is a way to, to provide for a healthier New Hampshire and to get health care to children and to families with the proper consents put in place that is necessary. I think that some of the concerns that have come up today are things that could be addressed in, I think in rulemaking. And if you are, so could be addressed in rulemaking if we wanted to go that far. I also found out that those services, because we have these clinics currently in place, so that's something, they don't bill. So that whole Medicaid expansion thing, that's where I was getting myself hooked up. We do have some Medicaid services we bill for in schools, but right now those they're covered under a grant. So that is not part of this. When it comes to access, I'm purely thinking about location, location, location. So, I mean, I don't want to outright kill it. I actually would want to work on it. The question is, if we interim study it, what work can really get done? But I mean, we're gonna be over. When we're gonna go into a whole new.
I understand.
Procedurally, Senator Lang, I'm just trying to understand how you would see this would work. Is there a way we could help Senator Ennis, put some meat on the bones and bring this forward? Because I think he came forward with well-intentioned, but I think we share a lot of the same concerns. That's the best way to put it.
Well, I have a bill coming up, not in education, but I think EDA or whatever, on a lot of guardrails on this particular issue. And if we put this on interim study, we can pull that bill when it comes. Then we can maybe combine them and take a look and consolidate those two bills.
So if I may, procedurally, right? So again, my point is I do want to study this. I think it's extremely important considering it's happening in our state and we don't have it. I just don't think, A, we have the time to do that now and do it good service. And I'll volunteer for the interim study committee to
Same
work
here.
on it. So I'll be happy to work on it because I think it's just such a big issue that we need to get DHHS involved. I think we need some school administrators. I think we want to hear from the schools that are currently doing this and what that looks like and what kind of services they're providing. I just think it's a big issue that this bill isn't nearly fleshed out enough to discuss. And I don't know that we'll have time to do it. And I think that if we know it's going to be an interim study, it gives us, from the time we pass it, we can form the committee and start studying it if we want. So we can prepare
We don't have to-
something
well,
for
we
a
don't have to-
recommendation
Yeah.
for the next term for someone to bring forward saying, we looked at this and here's all the concerns that a bill needs to have in it before, in order to be a good bill.
So thank you, Senator Lang. I'm just worried about running up against a deadline without being able to get the work done. So I'm willing to volunteer to jump in on this as well, because I think that there's more good than bad.
I would just argue, what rush are we actually in for this bill? I mean, let's just give the prime sponsor a week to see if there's any more meat on the bones we talked about. I mean, we're not in a rush to exec this bill today. Why not wait 1 week for the prime sponsor?
But if we know that we need to put more meat on the bones, and we have something else coming that may provide that meat, why not?
True, I'm just scared of living in
Yeah.
what ifs,
Yeah.
you know? A lot can happen in terms of, you know, when we say we're gonna do something, sometimes.
Senator Ward, can I ask a question of Senator Lang? Senator Lang, will you take my question?
Sure.
Have you had, I was thinking of texting the prime sponsor. Have you had an opportunity to talk to him, see what he wants to do?
I did talk to Dan about interim study of this bill and let him know that that was because of all the issues that even I knew before. I was concerned about the bill and about what was in it and what do you consider an interim study and work with us to be able to get what we need for future. And he was like, yeah, he'd happily work with us to get something going forward. So, obviously every prime sponsor wants their bill to pass, right?
I know.
But,
I
but he
hear
was
you.
also willing to understand that interim study would be a good alternative to be able to bring the message forward.
Senator Prentice? Did you want to
No,
say
I'm just saying, I don't want this to get lost. I want to make sure that this stays on track. And I do want to clarify for the record, although I think being although I'm not currently practicing now, I have practiced and I did provide immunizations both during flu season and participated in a number of COVID clinics. And before I ever put a needle in anybody's arm, I make sure there's consent, and it is highly unfortunate that had happened, but I don't think we should throw this all out because of those two cases. In fact, if anything, it drives us back to the point of education at the bedside or the clinic side, that you have to have consent before you do something. So that's really, that's just jaw-dropping moment. Okay.
So are we doing interim study?
We have a
I guess
motion and a
so.
second for interim study.
All those in favor of interim study?
Aye.
Aye. We don't
Move
put
consent.
this on- To put this on consent?
Yep.
Second.
Second for consent. All those in favor of consent? Aye.
Aye.
Who wants to take it out?
I'll take it out.
You want to take it out?
I love taking out consent bills.
Ask you why you're just like, I'll do this, I'll do that, I'll take these 15 bills out.
It's all on consent.
Ouch.
374, relative to the licensing of part-time teachers.
I'll move OTP on that.
Second. Motion and a second. Any discussion on 374?
Yeah, may I? So I hear,
Senator Prentice.
it just feels to me, I'm not against this. I think that what I'm not clear on is, I think there's got to be another mechanism that already exists, because there are these teachers that move between schools and school districts and cooperative agreements. I think the hiccup becomes the specialty area and the credentialing of that specialty area. So I'm just not clear how, and maybe I missed this. That's why sometimes I like time to go through the hearing report and think about it. Other times I can just do it, but I think that there's conceptually something to this, but what's the right technical way to do it? That is, so I don't want to vote. I don't want to vote against it, and I don't necessarily want. I want to vote for the concept, but I still want to work it out. Yeah.
I'm thinking if you have, for example, in the CTE, you have the owner of a shop who's done this all the time, and now he is giving a lecture, showing thing in the CTE center, and he's doing it for less than 30 hours. And this guy has done it his whole life. He's had people in his office. He's taught them how to do it, and all of a sudden now he can't do it without being licensed or certified. And it just seems to me that we're really limiting a lot of good people to come and help out our schools.
So, an interesting, so some of you know, I had a computer company, I had 22 employees, and I ran a computer, and I was right down the street from Winnisquam. I ended up entering into an internship agreement with Winnisquam where they sent a student down, and I taught them all about computers. But the funny part is if I went to the school, I wouldn't have been able to do it. But because the student came to me and in my shop and was considered an intern program, I could sit and teach that student all about computers and how they worked and building them and viruses and all those things, that networking, I could teach them that. But if I had to go to the school to do that same thing, I wouldn't be allowed to. And so it's kind of odd that we have that weird carve out that works that way. And it sounds like, speaking of Mr. Appleby, was that this is a legitimate way of getting, especially the specialty type of instructors, accounting and computers and even art. Like, again, it's not financially reasonable to ask a district to hire a full-time teacher to teach 1 or 2 classes a day. But bringing a local art, studio owner in to teach a class may make sense and allow that student to have that special that otherwise they may just do away with because they don't have a teacher, or they're going to bring the math teacher over to teach an art class because of that provision that they said to allow the minority class. So I think this is a really smart bill to deal with the shortage we have and able to get technically proficient people in to be able to instruct. Is generally probably going to be technically proficient classes, things like CNC and computers and art and no specials. Even a chemistry class taught by a college chemistry professor who doesn't necessarily have a high school certificate. We should allow that, any expansion we can. So I'm really in favor of OTP and really support this bill.
Senator Prentice.
Again, conceptually, I'm all there with you, but what's the rush? And if we're going to interim study I got 2 things, but if we're going to interim study the health services bill, why not this and get it right? The second thing is, and I don't know you brought up the teacher shortage, and I don't have the report. I could probably look it up, but I'm going to point to Senator Fenton and Senator Ward because you were both on that. Does it speak to this at all? Because Senator Lang just brought that up. We are struggling in different areas. Did you speak to the specialty piece of this as being a way to creatively address the shortage?
I couldn't tell you without looking at the report.
Yeah, and I would have to look at it too. So that's why I said I know I'm putting you both on the spot.
So I can't speak to that, but I can speak to, I was only here for half of this testimony. So if we vote on this bill today, I can't vote OTP because I didn't hear enough or study the testimony enough. So I'd like to wait a little bit on this bill to look at it a little more. And the reason I'd vote no today on this bill is just, I think there's a lot that goes into being a teacher. And, being a computer specialist doesn't qualify you to be a teacher per se. Being a car salesman certainly doesn't qualify me to go in and teach sales tactics. And I think, we're doing a disservice to our students when there's so much more that goes into teaching, communication skills, understanding, a lot of what you learn in schools and to be an educator. There's so much to be an educator. And saying, well, let's just say, they work less than 30 hours a week, they can be a teacher. To me, that's a little scary, especially if I'm sending my kids to these schools knowing that, well, we need a technician to work on cars. This gentleman offered up, his credentials already passed this, but he has no teaching experience, but we'll let him teach our kids. As of now, I can't vote in good conscience for this bill.
The only other thing I'd say, Madam Chair, is it goes back to local control. Again, your local school boards are hiring these people and only hiring these people after an interview and after a process, and they've decided that they're taking into account they may not have a state certification, and what does that mean? And having those in-depth conversations as part of a hiring process. So again, I trust the local school boards to hire the people, and just because you've passed the praxis exam and done X number of hours of student teaching doesn't necessarily mean you're a good teacher. And they have the same judgment they have to make for someone who is licensed by the state board as they don't. They have to decide whether or not this person fits the culture and can educate and has the technical proficiency. So I really support this bill.
One more thing, may I? And, so, again, in concept, but there are unintended consequences, and briefly, if you will indulge me, years ago when I worked for the state, and I'm reminded of this because recently Senator Jack Barnes passed away, and I was before him in a committee where he and a few others there was a concern that we had, as we have again with interfacility transfers of patients, between hospitals. And we had these really well-intentioned nurses that said, what's the big deal? If you can't get a second EMT, I'll just go. And so I was the chief of EMS and said, I understand you want to just go. You have a lot of the skill sets, but working alone in the back of an ambulance, understanding how to use the radio. What if the certain type of splint doesn't work correctly? Like, it wasn't that they didn't have the general knowledge. It was applying that in that particular setting. And as I tried to argue this in the Senate, I was pushed down. Okay. It was relentless to a point where I was like, oh, like, what do we do? And ultimately this bill passed. It was a sponsor was somebody from the predecessor from the Lakes region. It wasn't Senator Guida, it was way before that. So this bill passes. And so now here we have this bill that says a nurse can fill in for an EMT in the back of an ambulance during an interfacility transfer, especially if it's someone who's critically ill, because we know we want to move them. But I would argue, I actually think that sometimes they're safer waiting in a hospital than being in the back of the ambulance. So we put together a module as quickly as we can under great pressure, get that out there so that we can at least say, this is how you use the radio. This is if you have to adjust this split, if you have to do this, to try to make it safe for them. Well, the nurses, and they are great. They went, a group of them, like say 15 of them took this class. The first one that went on an ambulance ride, I think was from Lancaster to Dartmouth, said, I would never do that again. I had no idea what I was getting into. So, and again, great nurse in that particular setting. No disrespect, but that's the rush here, that if we go down this road, can't we just take a couple of days? Because the pressure was so great to get this done, and we spent hours working on this and getting this into law, doing all this to have it ultimately repealed a few years later because it wasn't well thought out on day one. And I think I appreciate what Senator Ennis has brought forward. I don't disagree with a lot of what Senator Lang has said. I just don't want to rush on this because I feel like I've lived through the other side of it. Okay, I think I'm done for today, and I know you're all thrilled.
We'll wait on 374.
There's a motion and a second on the floor.
It removes the motion.
I moved OTP and Carrie seconded it.
Okay. Now we had a discussion.
Mhm.
Okay. So it's going to be like, and all those in favor?
Aye.
There will be a 3-2. Do you want to take it up?
I'll take it out.
Okay. $376, that was today's. Establishing a corrections, education, and vocational planning group. Any, have a motion to?
Motion OTP.
Oh,
And I want to speak, after a second, I want to speak to that.
I'll second.
'cause I think there is a committee amendment we need to make on this.
Yes, 376. We're going to add
A member to the, it was Nick Duffy
Rehabilitation.
asked us,
rehabilitation and
OLPC, OPLC.
Yeah.
OPS.
The
I
executive
always
director.
call them, oh, yeah, I flip those all the time, okay.
I just asked that it be the executive director or their designee to
Desi-
give her the opportunity to be able to appoint somebody else.
A committee amendment, are we good? All right. Right.
Okay, that's a committee amendment.
So are you moving that amendment?
Do we have a
I'm moving that amendment.
I'll second it.
second? All those in favor of the amendment?
Aye.
Aye.
Let's go back to 376. We have a motion to pass, and we have a second. So all those in favor of the bill?
Aye.
The amendment?
Aye.
Aye. Okay.
Move consent.
Move to consent.
You can take it out. You're gonna take it anyway, so.
You want that one, Carrie?
Yeah, I'll take that one.
Carrie will take it
Oh.
out. I like to share.
Who's taking it out?
I am.
Sandra? Establishing an advisory group to examine potential funding sources for careers. That's, the 441.
376?
441,
441.
the one we heard today,
We just did the,
the advisory group or CT.
Yep.
I flipped, all right.
well, I learned that we actually have a state director for CTE, which I did not know we did.
I'll make a motion to OTP.
Second it. All those in favor of OTP on that one?
Aye.
That's 5-0. Consent?
Move consent.
Second.
All those in favor of consent?
Aye.
Aye. I'll take it out. You do something right. Anything else? 444. 444.
We open up for discussion first, because I want to ask Sue a question. So I'm in executing 444, which is Sue, your bill on documents for State Board of. Okay, we've already, okay. I'm going to move ITL, but maybe not in discussion.
So, second.
Okay, discussion. on
Um,
444.
I was hoping we had discussion first, but I think this is the conversation we were just having about, rather than call out the state board, school board, State Board of Education as a one-off for mandatory posting of documents that are different than 91A and everything else than any other board. But at the same point, we have an OPLC bill that the governor vetoed because of 91A concerns and the fact that it was calling out at all the boards at OPLC differently than every other board in the state of New Hampshire, from zoning boards to planning boards across the state. So I think the reason I'm moving ITL is, again, I think this is a bigger discussion about looking at 91A and doing a uniformed approach. And it may be adopting what they're doing over in OPLC for the all boards across the state. But I don't think that calling a one-off like this is the right way to do it right now. I think we have a bigger discussion to have about this. And so that's why I'm moving ITL, because I think we need, I'd even consider not interim study if we were to actually work on it. But even if it was an interim study, the problem is 91A doesn't belong in this committee. It goes to judiciary if it was a 91A issue. So that becomes a secondary component to this. So that's why I'm moving ITL, not because I don't necessarily like the concept, but I think for public access, but because I don't like carve outs like that. I think we need to look at the bigger picture and make a statewide policy that's uniform rather than one-offs.
Senator Prentice.
Understood. I think that since there's something already out there, I mean, I know I asked for the time to look into this, and I was actually looking at the wrong committee, because then I found what I was looking for. And I didn't, at that point, realize that this was a larger problem in state government. So look, everybody wants their bills to pass, but what I think is most important, if we're truly about transparency, is finding a way to do this for everybody. So do we hold on to this and try to find a home for this and everything else, like even interim study, or do we stop this now? That's because what will happen is this will get set aside and one whole group will become a carve out and not everybody. And I'm aware of other boards and commissions that aren't covered by OPLC, who some of them do have a very rigorous internal policy for posting of meetings, the agendas, the materials, and their minutes, but it's not true across the board. And so it's this like larger problem. So what we're going to do is fix one piece, but leave everybody else out. So do we fix that now? I'm going to get you a pen that doesn't have
Doesn't
something
have clicker,
on it.
sorry.
You're so funny.
All I can say is I'll commit to, again, depending on what next term looks like and whether I'm back and you're back, I'll commit to work with you on filing a bill that is a bigger, broader, cleaner bill than just a one-off. So
I do
I'll
think
commit
we
to that.
need to look at all of the boards and have something that's similar for all of them, not having one rule for this one and another rule for that one. And if we
Everybody,
could
yeah.
do it all together.
I know that at OPLC, they're looking at all the boards as a whole is controlled by that. But again, that becomes a one-off to 91A, right? What are we doing with Lottery Commission? What are we doing with Liquor Commission? What are we doing with all these other agencies that are all subject to 91A, but necessarily don't post agenda items?
You know, and my plan largely is to obviously support that other effort, but if we're against carve-outs, then it's kind of like talking out of both sides of our mouths, so it becomes difficult.
Right.
It's, you know, I wish in the early days and the rush to take care of what I saw as a problem, that I'd had conversations, you know, that I just, that piece that had already come up last year had landed in front of me, okay? And then I would have been able to try to do something to work this out for everybody. So I certainly don't want to ITL it. I do understand what you're saying, so procedurally, I'm not gonna vote to kill my bill. It's a vote for, as I believe you have spoken eloquently to, transparency. You just have a, you know, you want to take a different path, right? Or stop, and I will commit that if we're both sitting in these seats in another year, that we're gonna do this, okay? I know what your license plate is.
You're both on record.
We are on the record.
So do we do it interim study?
I think wasn't the motion ITL?
Yeah.
I don't mind if we're going to go to an study, I'll do that.
If you would go to interim study, I would,
I'll withdraw my motion and make a motion of
I would
interim
appreciate
study.
that.
And I will withdraw my second.
We are getting good.
Okay, we'll have the discussion. We're going to do, we have a motion for interim study and a second.
Second.
Senator Chet.
Yeah, I think we can find out some more information to get this thing going. Do you want to take it out? Do you want to take it out?
We got to vote.
I'll take, can I take
We
it
have to
out?
vote. We have to vote.
We have
on
to
interim
vote
study.
first, yeah.
That's the most important thing.
So miss- I must
Okay, all
know.
those in favor of interim study?
Aye.
Aye.
It's 5-0.
Move consent.
Second.
All those in favor of consent?
Aye.
I,
5-0.
I'd be happy to take it out.
Prentice can take it out.
Isn't the snow beautiful? Just wanted to add that.
I think that is,
That's it.
that is it, right?
So if
Well,
we,
Madam Chair, if I could just, a couple of things real quick. I do have a couple amendments coming in. They weren't ready, obviously, because of the holiday. The OLS couldn't get them out. So for the next meeting, we should have an amendment on 441, 442, and the building aid one.
Not
441 we just voted on.
I'm sorry.
all these
442.
fours
No,
and all these,
441. I mean, 341.
Oh,
I apologize.
341.
341, 342, and then the building aid one. I can't remember what building
Okay.
that is.
and I've got
I have amendments coming from various places, and they'll be ready for next week, so we
Okay.
should plan on maybe taking up those
Okay,
amendments.
excellent.
all right.
think
Would
that-
you, Centerlink, you know, we'll get a chance to look at those. I have a building aid bill that I need to bring in, but it's got a second section on it for student transportation, so I want to try to match those up. But 341 and 442,
I'm sorry, it was 340, yeah, I'm sorry, 341, 342, and
Three-
522. And not, when I get the amendments, I'll send them out to everybody in advance, so you guys have a chance. to look at them.
thank you.
I forgot to write down who's taking out 343. Innes's bill.
Lang is.
I-
Senator Lang.
It's on consent.
Lang.
I think that takes care of what we need to do today. Thank you. I don't have, do we have anything else? So we're motion to get out of executive session.
Seconded.
All those in favor?
Aye.
Aye.
Let's permanently
Thank you
keep my
very
hand up.
much.
Oh, Madam Chair, do we need to make a motion to
To hear
submit
the-
these bills so they'll be on this week's
Okay,
agenda?
so February
I don't know if
20th.
that's a motion or if that's just a procedure.